Hello, everybody, and welcome. I want to thank you for being here with us. We have a very special broadcast for you today with Dr. Irina Gelman, who is the commissioner for the Orange County Department of Health. So we're with a COVID update for all of you because there is a lot going on. Right before we started, she was filling us in with some other things that are very important. As always, without the support of our corporate partners, we would never have been able to withstand the past 4 months. They helped us to maintain our work for you in the business community. They allowed us to do all the one-on-one that we needed to do. So we want to thank them. And two of our partners today have generously sponsored this program today. So I'm going to invite Dr. Ken Steyer, who is the Dean of Touro College of Osteopathic Medicine. There he is, Dr. Steyer. Thank you so much for being here, and I'll turn this over to you.
Great. Oh, thank you very much, Lynn. I appreciate it. Just best wishes to everybody from the Touro College of Osteopathic Medicine, the only medical school in Orange County. Going on our 7th year. Orientation is this week, and our new group of students will be starting, and our building will be reopening on Monday. With a hybrid curriculum, a lot of online learning, but some labs, but with social distancing, masks, and all the appropriate precautions. We love being in Orange County. Working with Cornerstone Healthcare, Garnet Health Medical Center, and their physician group, Horizon Medical Group, and the Chamber of Commerce, and all our other great partners up here in Orange County. We have 540 medical students at the school, 70 master's students, and we're hoping for a new physician assistant program starting in January, which will add another 135 students to our total. And, we just love it here. Appreciate everybody's help and support. And we're glad to sponsor. Dr. Gelman's been a great asset to the school and guiding our students and providing internships for our students to see how real public health is provided. And we really appreciate that. And thank you for the opportunity to participate.
Well, thank you, Dr. Steyer, and thank you and to your students for everything that you've done for us here in Orange County over the past 4 months, because your students have really, as I said earlier, really helped us to stay together and be healthy here in Orange County. So it's a testimony to the quality of students that you have and the quality of education that you provide. And thank you so much for sponsoring this and for being a corporate partner with the Orange County Chamber of Commerce.
Thank you.
You're welcome. Thank you. And now we also have our second sponsor for today is Linda Muller, the CEO and president of Cornerstone Family Healthcare.
Hi,
Thank you, Linda.
Oh, my pleasure to be here. Thank you so much. Good to see you, Dr. Steyer, and looking forward to hearing from Dr. Gelman. Cornerstone Family Healthcare provides comprehensive care in 4 different locations, but my message today is really wrapped around the theme of COVID-19. I know how scary this virus is and how everyone wants to stay home, social distance, and not get sick. Please, regardless of who you see, who your doctor is, make sure you're connecting with your physician. Your diabetes is not going to go away. Your hypertension is not going to correct itself. You need to have a visit with your dentist. Children go back to school and they're going to need to be vaccinated. Being afraid to see the physician is not something that you should consider. It is safe, it is available, and it is ready to be of service to you. And a remembrance for all of your viewers that our history started with taking care of people who either had no insurance or underinsured. If you find yourself out of work with no insurance, please don't let that be a barrier to care. 563-8000 is all you need to do to call. We will help you get where you need to be. Your health care is important to us. It's important to this community. So staying healthy and engaging is where you need to be, even in COVID-19. So Lynn, thank you for your leadership. We are proud to be a member of the Chamber of Commerce, and I'm proud to work with you on the board of directors. So thank you for everything.
And thank you for everything also, Linda. I know that you folks have been open for the past 4 months and that you have really shouldered a tremendous burden. And your team was amazing, absolutely amazing. So kudos to you for your leadership, and thank you for all that you do for the Orange County Chamber and for all of the people in Orange County.
Just send a little love to everybody out there in the community and to you.
And to you too. Thank you, Linda. Thank you. And so now, without further ado, I'm going to introduce our guest to you today, and it is our absolute honor and our privilege to be able to have a conversation this afternoon with Dr. Irina Gelman, the Commissioner of the Orange County Department of Health. Dr. Gelman?
Good afternoon, Lynn, Linda, Dean Steyer. Thank you very much for that introduction. Hopefully everyone can hear me. I did want to say a good afternoon to everyone. And first and foremost, I would like to thank everyone for their collaboration in the past many months. It has been the long haul for us and for all of our community members. This has truly been a Herculean effort on everyone's part as far as the community coming together to combat the local impact of this global pandemic. We can't thank everyone enough, but I did want to really mention the Orange County Department of Health team, the Medical Reserve Corps. We have had a number of members join, especially quite a few from the Toro College, from the Medical College. We had emergency services, EMS, police, fire, hospitals, all the medical groups, nursing home workers, all essential workers and volunteers. I cannot relate to you the full extent and the sheer volume and scope of this response. I mean, the magnitude truly has been Herculean. In terms of the impact and what we are seeing now, I know that widely it is understood that we do have a lower prevalence than we have had before. But in terms of putting it in perspective and really relaying the numbers of what is going on in Orange County, to date, we have had 11,085 confirmed COVID-19 cases in Orange County. Clearly, that does not mean that all of them are currently active cases. As far as new cases, we are seeing some new cases. We have had 16 more cases than we have had yesterday. And prior to that, we had had upwards of 30 cases the day prior to. We have had 96,368 Orange County residents tested to date. And this includes unique Orange County residents, any individual that's tested multiple times. That is recorded under their number, and it is a unique encounter in that 96,368 people tested. We have had 491 people tested yesterday, and just to kind of dispel any rumors right off the bat, the 11,085 only include COVID-19 testing. They do not include antibody testing. They do not include presumptive positives. These are individuals that have been tested via nasopharyngeal swabs, PCR testing. So these are actual confirmed active COVID-19 cases which were diagnosed and lab confirmed. As far as what's going on in New York State, just to put it in relative context, there have been 5,684,546 residents in total tested to date, and that's New York State. Just the sheer scope and magnitude of this. With 412,878 tested positive in New York State altogether. So to put it in perspective, Orange County population is upwards of 380,000, which is about 1.9% of the total population of New York State, which is 19.45 million for New York State. So we comprise about 1.9% of the total population of New York State, while our test positive for the total number of test positive to date accounts for 2.6% of that total 412,000. So to date, we have 11,085 cases. As far as what we are seeing with data distribution, and this is tremendously important if we are to curb this and really try to contain the new transmissions and the new cases we are seeing. As far as the age category, and these are confirmed cases of COVID-19 in Orange County by age group as of July 22nd. So this is a total value of 11,016 cases as of July 22nd. I know I mentioned more, but that's an up-to-date number as of today. But this graph includes a number as of July 22nd, and that's 11,016 confirmed, lab confirmed, not antibody testing positive. We had 474 cases in the birth to 17 years of age category. We have had 4,853 cases in the 18 to 44-year-old category. And to date, this remains the largest category of both cases positive to date in Orange County, as well as the new cases. So overwhelmingly, we are seeing new cases, so current load of new cases in the 18 to 44 category. So they are contracting it and transmitting it at higher rates than any other age demographic in Orange County. And that is cause for alarm because that tends to be the demographic, generally speaking, that has a lowered perception of risk to begin with. So with that diminished perception of risk, possibly not adhering to all of the safety measures as far as masking and social distancing, and having the highest prevalence in that age category, those number of factors combined tends to kind of form the perfect storm for continued transmission and for the new cases that we are seeing. The next age group is 45 to 64 with 3,879 cases.
Wow.
And in the 65 to 74 category, we've had 879 cases as of July 22nd, as I mentioned, out of a total of 11,016. And as far as 75 and over, we have had 931 cases. And I did want to briefly mention, just to circle back to what we were discussing before, as far as new cases, so just for the last month alone, and you can clearly see a column that's really quite apparent there. And again, that tends to be that 18 to 44 category. And as far as exposure and predisposing factors, and we do break that down after communicable disease investigation and contact tracing, quite a large proportion tend to be travel related also. So that tends to be the phenomenon that we are seeing now. And before I open it up to questions, I did want to mention a couple of just question and answers that we have been frequently receiving. And as far as what's the real purpose of masking, social distancing, and hand washing, we have been receiving that a lot. It's clear we have a lower prevalence right now in New York State and the tri-state area. We're not seeing the rates that we are seeing in other states that are right now lighting up. So what is the real purpose? And polls do show that the majority of Americans are wearing masks and trying to maintain at least 6 feet of distancing from others, and increasingly washing their hands during the pandemic. However, right now we're sort of losing focus. I know there's a lot of fatigue associated with the shutdown, with quarantining measures, and we are losing focus why these public safety measures are important. So now, as more Americans return to work, visit their friends and families, venture out for the summer, there's a new and a very dangerous narrative that's forming that we are hearing quite frequently. We're reopening, the world is reopening, the virus might not be as bad as we would imagine it to be. It's a myth, it's a hoax. And this currently is what's fueling the outbreaks that we are seeing in over 30 states that are currently on that travel advisory for New York State, from the New York State Department of Health. So clearly, the goal still remains the same as we have had set 6 months ago, which is to flatten the curve. It's about preventing huge spikes in cases, and all it takes is one major event, one mass gathering, to really be a super spreader event and to contribute to a huge spike. Anytime we have a huge spike or an outbreak, every single individual that is in that outbreak, once we start contact tracing and once we start the communicable disease investigations, one individual may be responsible for an exponential increase in cases. So all it takes is one, and I'll kind of go into that a little more as we progress with the program. But for now, keeping our hospitals, our critical care units, and morgues from becoming overwhelmed, so emergency services, hospital, critical care units, morgues, which is essentially our capacity. And I know the narrative has been kind of polarized, changed throughout the course of the pandemic, but to keep it strictly apolitical and sticking to the facts, this has always been about capacity and resources. That is the finite factor here. Every single entity, whether that's Orange County, whether that's New York State, whether that's nationally, there is a finite, limited amount of resources. And we will go into kind of comparing COVID with flu and everything else. However, for the time being, we have a finite amount of resources. And unfortunately, with COVID-19, dealing with that influx of new cases over a very short period of time versus the flu during the flu season, which is over a course of 6 months, presents a challenge, because those resources that we were discussing as far as capacity As far as continuity of operations, we take into consideration hospital availability of beds, and those beds obviously have to be staffed. So staffing continues to be a concern when we're dealing with the height of this response. Nursing homes, first responders, morgue, contact tracing, and as far as resources, PPE and supplies, that continues to be the rate limiting step. So if we are to experience an influx such as the one we have seen in April, the trouble is that finite amount of resources. That's when we're truly dealing with the fact, and that's when we run into issues where does it really matter if those beds are taken up with COVID? And unfortunately, if there is to be a resurgence of COVID-19 as we head into the fall, this time around, it will be concurrent with the flu season. So we're dealing with complications of COVID as well as the complications of the flu. Once those beds on those resources are allocated and taken up, what do we do then? So for those individuals that are 18 to 44-year-old that are quote unquote healthier by their own definition and may not see the complications of COVID-19 specifically and may not necessarily worry about other members of the community or the older individuals, the younger individuals, or issues that don't pertain to them necessarily. Collectively, we still deal with community resources. And once those resources, once that capacity is exhausted, what happens when you're in a car accident? What happens when you have an overdose? What happens when you're dealing with a fracture? If you present to a healthcare system that is not able to address your issue at the time, does it truly matter whether it's pertaining to COVID, flu, or anything else? Does the reason why the resource is exhausted truly matter? So that's what we are doing. That's the focus with social distancing and potentially locking down, quarantining, social distancing. So until more individuals kind of understand and embrace the value of masking and distancing and hand washing, the troublesome trend that we are seeing will continue as far as new cases, as far as the trends that we are seeing nationwide. So hopefully, if nothing else, this will speak to the fact, to the importance of truly adhering to those safety measures and ensuring that we're continuing to open up, that we're continuing to resume regular activities. And if for nothing else, it's for our liberties and to really enjoy the fact that our businesses can continue to thrive versus the alternative. I will address a couple of more and then we'll kind of go back and forth because I definitely don't want to take up all the time. Why and when should I get tested for the coronavirus? You still have to have either a COVID-19 exposure, you still have to have at least some symptoms. Despite the fact that majority of cases, about 80%, are either mildly symptomatic, or I don't like to use the term asymptomatic, it's really pre-symptomatic or pretty much mildly symptomatic. The National Institute of Health still recommends really making sure that you do have some clinical criteria for testing, because don't forget, it takes 2 to 14 days to incubate the virus from time of exposure. Once you have incubated that virus, that's when you will test positive. So if it takes you 10 days versus me, let's say 2 days, if I present for testing prior to actually having that viral load that will test positive, that test will be negative, and it will be negative erroneously. You will use that as an exclusion criteria. You will say I tested negative when in fact you're still incubating the virus and you're still highly contagious. What is very important to note, specifically with COVID-19 versus SARS, and this is something kind of we learned along the way in the scientific community, there were elements of this infection that were unexpected if you compare COVID with SARS. And this is yet another testament for the importance of wearing masks. With SARS, the amount of virus in the person's mouth and nose and body increases steadily for the first week or 10 days after infection. So you're progressively more contagious as you go along. That's with SARS, which is closely related, but not the same. With COVID, it's quite the opposite. So the viral load is highest just before people feel truly sick, which is yet another testament to the importance of wearing a mask at all times when you're in close proximity to other individuals, because if you're shedding that virus in droplets, it's quite important to mask up so you're containing those droplets, so you're not spreading them and passing them on prior to even your own knowledge of being contagious at that point. So as far as testing, the National Institute of Health, the lead medical research agency, did unveil a plan to ramp up testing, which is very promising. They're promising to create the capacity for 6 million daily tests by December, which we're really, really hopeful for. So besides vaccination and pharmaceutical interventions, that's quite important. And this will contribute very importantly to the current national effort to curb the spread of the COVID-19 pandemic. And of course, assist us with contact tracing. So again, 80% of infections are mild. When we're comparing this to the flu, and I know that has been a very widely debated, this is just a little more complicated than the flu. No, it is not. We have had a 13 to 15% rate of hospitalization and complication associated with COVID versus a 1% hospitalization rate associated with the flu. Plus, when you're combining that with the fact that COVID-19 happens over a very short period of time, for us, it happened within a period of about 8 to 9 weeks versus the flu season, which happens over 6 months period of time. So absolutely not, quite differently. And if you compare that to the 0.1 mortality rate of the flu versus the 3 to 4% mortality rate that we've seen here, again, quite troubling. I will briefly mention another local statistic with us. As far as confirmed and probable deaths of COVID-19 in Orange County, and again, this is as of July 22nd, from the total of 472 cases as of July 22nd, so 472 deaths of Orange County residents, confirmed and probable COVID-19. So again, to dispel more rumors, we do use the national criteria for vital statistics for all death certificates, whether stemming from COVID or anything else that's diagnosed. So these were majority lab confirmed cases. At the height of this pandemic response, we did not have enough test kits. We were preserving those test kits for individuals that were hospitalized and individuals that were ill. So about 6 or 7 post-mortem patients did not get swabbed. However, they all had to meet medical and clinical criteria for actually being diagnosed with COVID-19. So their doctors actually wrote in their medical charts, and our 2 medical examiners, which are MDs, had to certify that death certificate where those 6 individuals met clinical criteria. They had a direct exposure to COVID-19 and expired as a result of complications of COVID-19, because I know that has been kind of a widely spreading rumor there. Right. In terms of distribution, 18 to 44-year-olds, we have had 20 deaths in the 18 to 44 category, quite a few of them without underlying medical conditions, quite a few of them without the history of smoking and vaping, which is surprising. But that has been the case. I have reviewed quite a few of those cases. 45 to 64 age category, 84 cases. Again, a lot of them without an underlying medical etiology, so not well-known comorbidities there, and no history of smoking and vaping in quite a few of those cases. 65 to 74, we have had 103 deaths, and we have had 265 deaths in the 75 and over category. So extremely important to note that, yes, overwhelmingly, maybe even disproportionately, the deaths and the hospitalizations are clearly in the population that is older. However, going back to those capacity and resource shortage issues, if we are to see a continued outbreak and spike, it's tremendously important to do everything we can right now to prevent those total number of cases from going up, because that 13 to 15% hospitalization and complication rate that will exhaust all of our local resources is from the total amount of current positive cases. And that has been consistent nationally and globally, that 13 to 15% hospitalization and complication rate, as well as that 3 to 4% mortality rate. So 80% of COVID-19 infections may be mild. However, you still have that capacity to transmit. And of course, we are seeing another phenomenon that's quite disturbing with contact tracing. And contact tracing are the only viable means besides masking, social distancing, and washing our hands that we have at our disposal currently, in the absence of vaccination, in the absence of pharmaceutical intervention, to really do the contact tracing, isolate and quarantine in a timely fashion, so we interrupt that continuous propagation and the spread of this disease. However, there have been 65% of infected Americans, and this is not local to Orange County, refusing to share names of close contacts with tracers. And clearly the virus will continue to propagate if we are not contacting those individuals, and we're not testing in a timely fashion, and we're not isolating and quarantine. So why does the science of COVID-19 continue to be so confusing and at times even, I would say, contradictory? There's still a lot we don't know. There's still a tremendous amount we don't know. This is a novel coronavirus. Coronaviruses in general are known, well studied even for some strains. However, with this particular virus, we don't know quite a bit about it. And for instance, some of the questions that still kind of linger, and there's contradictory even research articles on it. Super spreaders. How come we have some individuals that continue to be super spreaders, where they're single-handedly responsible for a tremendous portion of individuals that get infected after exposure, and a lot of individuals don't really spread the virus that much outside of the household members? Also, persistent positives. There's still a question of remaining persistent positives. Individuals who continue to test positive for months on out. They're not contagious. 10 days out, they're not truly contagious, but they continue to persistently test positive upon testing. And antibodies. This brings me to antibodies and the entire concept and the notion of herd immunity. We have a lot of members of our community that believe that that's it. The virus has burned through a large portion of our community because we're in New York State, and we now have herd immunity. Absolutely not. That is a false assumption. First and foremost, we don't know if antibodies persist, if we continue to have circulating antibodies, and what actually happens in the event of secondary exposure. Are they reactive? Are we mounting an immune response, or can we get sick secondarily? So as far as antibody testing, because in lieu of that fact, antibody testing still continues to have very little clinical value, and that's what you will hear in the medical community quite frequently, because we just don't know as far as that persistent immunity. Also, are not numbers, meaning how many individuals will continue to get ill as a result of exposure to someone who has COVID-19. For COVID, that R naught is anywhere between 2 and 3 versus the flu, where it's about a 1. So for every one individual that's sick with the flu, one other will get it. For every one individual with COVID-19, about 2 to 3 or 2.5 will get it. The reason that is important is for that herd immunity concept. In order for us to effectively have any attempt at herd immunity, we truly need to ensure that we first and foremost have a vaccine so we can vaccinate the majority of the population. By majority, with an R naught of anywhere between 2 and 3, you need upwards of 60% of the community to be immunized or to have had the disease and have a valid immune response. And with a US population of upwards of 328 million, that would constitute about 200 million people. So that's a very important prospect as we're hearing about vaccine development. I know there are 2 vaccines that have currently entered phase 3 of trials. I know there have been over 125 vaccines overall that have been in various phases of development. Currently, 2 are showing promise. There are 7 in phase 1 of research, 7 in phase 2, and 2 currently in phase 3, which is, again, very promising. However, individuals still have to get immunized in order for us to even have the potential for developing immunity. I will open up to some questions, and then I'll kind of revert back to I have quite a bit of ground to cover.
Well, I have a number of questions myself, but I'm going to, we have a question regarding schools. So it's from Erica. She says, thank you for your work, Dr. Gelman. As schools reopen, what will the guidance be if a student or teacher becomes infected? Will the entire class be expected to quarantine? Are you familiar with that at all?
Yes, absolutely. So as far as guidance, so those are 2 separate questions. As far as guidance, New York State Department of Health, along with New York State Ed, they are developing a joint guidance. I believe they're waiting for August, and I will explain the reasons why August a little bit later on. It is data-driven and statistically driven. We discussed that in the intermission. As far as what schools will need to consider, there are safe ways of reopening. I know a lot of schools are considering kind of the hybrid model for reopening, where partially staggered times of arrival dismissal, remedial dismissal as well as busing. There will be some integration of remote access technologies for older students, so on and so forth. As far as the secondary portion of the question, if there is an exposure, so if an individual tests positive, that individual will be under mandatory quarantine. Any individual that has been exposed will monitor for symptoms, whether or not that particular individual, and that's where contact tracing really comes in. When we do a communicable disease investigation, we ask quite a bit of questions to recreate a timeline, because remember that incubation period of 2 to 14 days, we truly try to recreate the timeline of when the individual was actually symptomatic. So once the individual was symptomatic and was shedding the virus, and we usually look about 2 to 3 days prior to that because of that mild symptomatology, that's when we contact every single person, whether in the classroom or in the close vicinity. It's very doubtful that the entire school will close. I know that has been another misconception, but we will recreate the timeline, and individuals in close proximity with the potential of exposure will continue to monitor for symptoms and potentially even be on precautionary quarantine depending on that proximity. Exposure constitutes more than 6 feet and over 15 minutes. So if you were in close proximity versus just passing by in the hallway, clearly the potential for exposure is a lot greater. Also, don't forget masking and social distancing. There's precisely a reason why we're masking and social distancing, and that will continue throughout school as well because of that potential for exposure.
That was a lot of information, Dr. Gelman. So, okay, so that was one of the questions. And then some comments about how good the information is and that it's facts, not fluff. So thank you for that. You mentioned travel, that you're seeing from travel. And these are travelers, obviously, from other states, because we're not, as Americans, allowed to really get too far afield right now. So this is people coming in from other states, going to the beach, going to other places. And that's where we're seeing some of the increase in the numbers.
Yes, absolutely. So if you visit the New York State Department of Health website, they have a list of restricted states, and currently there are over 30 states. I can list them out: Alaska, Alabama, Arkansas, Arizona, California, Delaware, Florida, Georgia, Iowa, Idaho, Indiana, Kansas, Louisiana, Maryland, Missouri, Mississippi, Montana, North Carolina, North Dakota, Nebraska, New Mexico, Nevada, Ohio, Oklahoma, South Carolina, Tennessee, Texas, Utah, Virginia, Washington, Wisconsin. What this is truly based on, again, a lot of this is statistically driven. This is based on a 7-day rolling average of positive tests in excess of 10%, or number of positive cases exceeding 10 per 100,000 residents. So what that means is if there is a higher percentage of propagation of COVID-19 within that community, that's when those states are put on the list, on the restriction list. What that means for us, if you have traveled to that area, again, going back to masking, proper social distancing, and truly just a personal accountability to what that means for the community at large and for the potential of transmission. We truly want to avoid outbreaks, local outbreaks, because we do want to remain open. We do want to continue to open up. So for that reason, any individual who has traveled to a region of higher prevalence of COVID-19, we urge you to please remain under precautionary quarantine for the duration of that 14-day period, because as we mentioned, 80% of that mild sequelae of disease, mild symptomatology, will be responsible for the potential transmission to others within the community. We don't want that to happen, because those numbers will dictate whether businesses remain open, whether we resume school. And as a mother of 3, believe me, I want to make sure those schools resume operating.
That's good information. Now, another question. One of the things that I've seen, and we're already over time, but we'd like to do this again, so I'll follow up with you on that. But a quick question, and I don't know if you were going to address this. One of the things that we're seeing now is we're seeing people with lingering effects of COVID. They were infected, they were sick, they got over a lot of the major stuff, but now we're seeing, or they're speaking about these lingering effects. Could you address that a little bit?
Absolutely. And that goes back to the question that I addressed earlier with what still remains unknown to the medical community, there's quite a bit that we currently know, and throughout investigative research, we are finding out more and more each day. But as far as long-term impact and long-term effects, whether they're neurological, whether they're vascular, we are seeing some residual effects, and not just in older individuals. Some individuals that are healthier, quote unquote, some individuals within that 18 to 44 or 45 to 64 category. But it is imperative to note that we do not know long-term impact and long-term complications of COVID-19, which is quite another reason and testament to the fact that simple measures, social distancing, masking, washing hands properly. And I did want to note, as far as properly wearing a mask,
Yes.
I've been meaning to do a demo. We haven't had the time to do it. However, with masking, and I will demonstrate very briefly, it's imperative to ensure that this mask is worn properly over one's nose, covering, and when you are putting on a mask, you're holding it by the actual loops, and it's important to wear it over the nose and under the chin, so you are containing those droplets. So if this is the mask, you are taking it off and putting it on by the loops. You're sanitizing your hands prior to and after taking off that mask. And very importantly, and I know there's a protracted debate whether masks work, whether they do not. If worn properly by everyone, they will work and they will contain the spread. But otherwise, this mask will act as a magnet for contaminants. And if you are mishandling it, so the outside portion, the external portion, is the contaminated portion. If someone sneezes on you, they will sneeze on the external part. If you're wearing it upside down, reverse, inside out, and if you're touching that contaminated portion, it defeats the entire purpose of wearing a mask. If you're just wearing a mask to get into a shop or to get into a business, again, it defeats the whole entire purpose of wearing one. It's for your protection and for the protection of others. So when you're donning that mask, make sure you're sanitizing your hands prior to washing them. You're putting it on properly over your nose, mouth, and chin. And when you're taking it off, you're also not only taking it off properly and disinfecting your hands after, but you're utilizing some sort of storage device where you're putting it in a Ziploc bag. You're not tossing it on the dashboard. You're not putting it in your back pocket. I've seen masks as decorative objects on the car. I've seen them tossed in bags. There has to be an isolation for dirty disposable masks. Also, if those masks happen to have, so another type of mask, if they happen to have some sort of mechanism to pinch the tops, make sure that's closed off, because the better of a seal you have, the more contained those droplets. Because remember, droplet precaution. I know you heard a lot about airborne COVID-19 versus aerosolized. I know with Johns Hopkins, even the World Health Organization kind of vacillated back and forth on airborne versus aerosolized. We still tend to lean towards aerosolized versus airborne, and that's
Could you define that for people, what the difference is?
As far as airborne transmission, so for a lot of viruses that have a higher rate of transmission, so for instance, measles that are not factor. For measles, if you put 10 individuals in a room with one of them having measles, in that room, so one individual and 10 people that have not been vaccinated against the measles, 9 out of those 10 people will contract the measles. It is the highest contagion that we know, versus Ebola that may be more deadly but not as highly contagious. So as far as airborne diseases, we would see a much higher prevalence with an airborne disease. That's why when there's discussion about airborne, and I know there's been a lot of conversation about HVAC, a lot of filtration units, and kind of the need for that. Yes, in malls or higher congregate settings, so settings with a lot of density, population density. So when you have a lot of people together, let's say choirs or people that are forcefully expiring, where your saliva is aerosolized, where those droplets are split up into smaller droplets, and I'm kind of spitting and projectile spitting all over because I'm trying to sing or I'm trying to speak. Clearly, that would be an environment of higher propagation. So that's why you see the risk-benefit analysis with a lot of businesses where we're sorting, well, gym, but not as much with outdoor. So that's where you're seeing the classification in outdoor aerated space versus a space that's enclosed. It's for that projection of those aerosolized droplets and that potential. But I wouldn't necessarily call it airborne, because for a disease to be airborne, that means those particulate viral particles, they're a lot lighter, where they can actually be airborne and they will transmit a lot further, versus saliva and actual droplets that will contaminate the surface. And there's the need for those masks and for that containment effort. And that's why a lot of procedures like nebulizers, like dental hygienist procedures, they tend to aerosolize saliva and droplets, have a higher potential for propagation. We have different guidance documents and so on and so forth. Also, as far as surgical masks, I will mention one last bit. Surgical masks, I've seen them upside down, inside out. I've seen them crumpled up. If you have a new surgical mask, clearly the darker portion, the colored portion goes on the outside. You do have that little tab that you pinch onto your nose. And this is a fresh mask. You put the loops over and you actually take the bottom under your chin. So you want to make sure you're tapering that. You're leaving it on so you have that containment under chin, taped over. And when you're disposing of it, and please dispose of it in the garbage, I've seen them all over, you're taking them off by the loops and again sanitizing your hands and either disposing of it, or if you have one for that day, make sure you're putting it again in that Ziploc bag and isolating it from everything else, because ideally when used properly, the top surface is contaminated. You don't want to touch it and spread it all over. And with cloth masks, one last bit, please wash them. You wouldn't put on an undergarment such as underwear the next day without washing it. Same goes for the mask. If it's contaminated, wash it that same day. So have two interchangeable, put it in a Ziploc bag, store it, take it out by the loops, and then wash it, please.
Okay, that was a lot of information, a lot of really good information. So we're just about at the end of our time. Is there anything that you wanted to fill in with that? Anything, any last comments?
I did want to mention, as far as just businesses in general, and we love the fact that we're continuing to work together on a lot of safety measures. It's extremely important, whether it's schools or churches or whether it's a gym or any other business. At this point, screening questions are extremely important for staff, volunteers, for the actual patrons. Those screening questions have to include travel-related questions. We have had a number of individuals that were just recently tested that don't wait for that negative test and present to work. And I know we're short-staffed. There are a lot of other issues, but it's extremely important to ask questions of your staff, of your patrons. Also, signing in and making contact tracing easier for us. We're doing this 2-3 weeks out, trying to recreate that timeline so we can isolate other individuals and anyone who has been exposed. So just screening, proper contact tracing, and really ensuring that masking, social distancing, and a lot of those safety protocols are adhered to, not because it's a guidance document or something to be enforced, but because we collectively want to ensure that our community resources are available to us when we need them, and that we're stopping the spread and continuing kind of resuming normal operations. And what we really learned throughout this crisis is that it's not about making the risk an absolute zero. We'll never get to a point. I mean, maybe eventually with vaccination and with our pharmaceutical interventions, but that risk won't be an absolute zero anytime soon. However, it is about understanding it so that we can really manage it responsibly and hopefully collectively. It's truly a collective effort. It's not about enforcement. It's not about anything else. It's truly about personal responsibility and community response.
So I want to thank you, Dr. Gelman, so much for doing this with us. I am grateful for your partnership with us. We have a great conversation with the Orange County government. We're working with Orange County government for the PPE, and with you, you have done an amazing job. You have the comments that I see on the sidebar here is about how devoid of politics and no fluff, and how informative this has been, and it is, because we get hit with so much information, and it comes from all sides and from all lenses and perspectives, and you've given us facts, and that's really what we need. And I want to thank you very much for the amazing work that you've done over the past 4 months, because you have kept us safe. So we appreciate that very much. And I want to thank again our partners, Linda Muller from Cornerstone Family Healthcare, and Ken Steyer who is Dr. Ken Steyer, the Dean of Toro Osteopathic Medicine, for sponsoring this. And Dr. Gelman, I really cannot thank you enough. This has been an amazing, amazing 45 minutes that we shared with you. I know you're very busy, so that means even more to me to know that you took this time out of your exceptionally busy schedule for us and for the business community. And this will be on Facebook. It will be uploaded to YouTube, so you will be archived forever in the digital library of the Orange County Chamber of Commerce.
Thank you very much for the opportunity, and thank you for having me here. Hopefully we can do it again. Time flies when you're having fun.
It does, and when you're giving facts. So thank you very much, Dr. Gelman, and thank you to everybody out there for sharing this time with us. Please remember, as Dr. Gelman said, to wear your mask, social distance, wash your hands, and if you do get sick, make sure that you do the right thing with contact tracers so we can slow the spread. We want to remain open. We want to get the rest of our businesses open, and we all want to stay healthy. So thank you very much. Have a great rest of Tuesday.
Thank you.
Thank you.